To take a 2D panoramic image with our patient chart up within EzDent-i, we simply click on the Acquisition tab on the top of the screen and select Panorama on the panel to the left. It will then take us into the PaX-i interface screen to select our options. First, we begin with patient gender. Options include man, woman, and child. Note, the system will automatically choose child if the patient is 12 or under in the system. To the right of gender, we have exposure-based settings based on the patient's density or size. Options are hard, normal, which is your default, and soft. Moving to the image quality options, to the right column are UHD, ultra high definition, used for Bitewing, which we will discuss later in this video. HD for high definition, which is your default, and the normal option, which reduces the scan time from 13 seconds down to 7 seconds, making this an ideal setting for any patients that have stability issues. The pan quality is still a high quality image. Next, select an arch size selection below, narrow, normal, which is your default, or wide. Moving down to the panel examination area, standard is your default, capturing all dentition and condyles. Additional options include right side only, left side only, and front. Also notice the message information area on the bottom left of the screen, always displaying the status and the next steps to take. Once our selections are made, we can simply click confirm and move on to position our patient. Follow these simple steps to acquire an extraoral Bitewing image, which is very similar to acquiring a pan with your PaX-i device. On the acquisition machine, select the following: UHD, below this orthogonal, which initializes the Bitewing options below, and select Bitewing. Also available are right side only and left side only. Continue with regular pan protocol, however, with one exception. When viewing the canine laser beam during patient positioning, position the canine beam light approximately at the lateral tooth and not the canine, which just moves the field of view slightly more anterior. In preparation, have the patient remove all metal objects from the neck up, including necklaces, eyeglasses, earrings, and any other metal object.
We'll review PaX-i, panoramic patient positioning, Bitewing positioning, and other specialty modes for the PaX-i device. The PaX-i includes a chin rest with bite stick, also includes your edentulous cup. This will be used for patients who are missing anterior teeth, fully edentulous, or have troubles biting in the bite stick groove. I'm going to go ahead and initialize our device, and we will bring our patient back for panoramic capture. Once our device has initialized, we can see that the positioning beams have been illuminated. I'm going to go ahead and bring our patient in for patient positioning. Having our patient stand up straight and tall at attention, I want to evaluate the patient's chin to the base of the chin rest. I want to use my touchpad and bring the device just below the patient's chin. Next, I'm going to start with the hands, palms facing up, feet step forward a little bit and shoulder length apart. I'm going to have the patient open and go ahead and bite on our bite stick. With the patient biting in the bite stick, I have the patient smile, and I can see that the patient is in the bite stick groove. Next, I will push down on our bite stick to ensure their chin is firmly on the chin rest. We have several positioning beams. First, I'm going to look at my mid-sagittal beam. I want that to line up right between the eyes and right through the philtrum. Next, we want to make sure the patient is in a natural head position, or the occlusion is tipped down about 10 degrees. So I'm going to have the patient smile really big. I'm going to look from the side at the maxillary occlusion. In this case, I'm going to go ahead and lower our device down slightly, ensuring the patient's occlusion is tipped down 10 degrees. The PaX-i also includes a Frankfurt horizontal beam where we can line it up from the top of the tragus to the infoorbital notch of the eye as a double check for occlusion. My next step will be closing our temple supports to ensure patient stability. Once I have my patient in the device, temple supports closed, I'm going to adjust my canine light. On the side, adjust the lever, have the patient smile really big, and we can line our canine light up right through the center of the canine. In the case that we are positioning for an external bite wing, we want to move that canine light forward just mesial of the canine. Once we have our patient positioned, I'm going to go ahead and have the patient close their eyes, close your lips around the bite stick, go ahead and swallow and keep the tongue to the roof of the mouth. We're going to step out of the room and we're going to go ahead and take our image. I've selected ready on the device and the device is now initializing for image capture.
Close your eyes until image capturing is complete.
The exposure switch allows the operator to control the image acquisition process from outside the X-ray room. Press and hold the button down until the acquisition is fully complete. The light on the switch will turn yellow when image is exposing. Premature release of exposure switch will abort image acquisition.
Image capturing is complete.
Once the image capture is complete and the overhead stops rotating, I can release our patient from the device. I'm going to open our temple supports and our patient can take a step out and be released.
Chin support with normal bite block. Chin support with edentulous rest. Note, use a cotton roll to separate the bite. Sinus rest / TMJ rest.